Right, welcome back to our clinic, and today I'm with Courtney, who's actually a regular patient of mine, and today we're going to talk through some of her concerns and how we can use a combination of toxin and filler treatments to get the best results. So welcome to the clinic, Courtney.
Thank you.
So in your own words, how are you doing and how can we help today?
Yeah, very well, thank you. My main concern is that I've lost the softness to my face, and I used to have a more heart-shaped face, and now it's becoming quite square, I think, where it's kind of sagging a bit. So I just wanted some fullness and lifting.
Okay, great. And how recently have you noticed those changes?
Well, probably since I turned 30.
Since you turned 30?
So over the last 5 years.
Okay, and so how old are you now?
I'll be turning 36.
Turning 36. So I've been treating you since your late 20s, is that about right? So previously with Courtney, we've done a variety of treatments, all of it very subtle and very natural. I think you may be able to notice here, under eyes have been treated. We usually use some botulinum and toxin in the upper face. But let's go through Courtney's concern, and I'll try and show you what I see systematically in terms of what I think is possible today. I think the first thing to notice is I really like the shape of Courtney's face. I think she has very symmetrical, very attractive features, very, very good underlying bone structure. And you see that because of the really nice shape to her cheekbones, but also the lower third of Courtney's face is the most dominant third. And you see this because of the mandible, the structure of the mandible. The thing that draws my attention is also the width here, the bigonial width. And because of this beautiful structure, when Courtney's in her 20s, late 20s, the skin is tight around that structure, and it's a very aesthetic appearance. But what happens, the flip side to having this great structure and also these strong chewing muscles, is that with aging, when we start to get a little bit of laxity, it can easily start to look a little bit square, a little bit masculine. And so Courtney's concerned today about feeling like she's looking, I think it was in your words, you used to look like your mum and now you look like your dad, right?
Morphing.
That would be the reason why. And it's important to understand the difference in aging either side of this line of ligament. So laterally we have this passive sagging, and that means in combination with the strength of this chewing muscle, we're getting a lot of heaviness in the lower face. And so this is a challenging treatment because we have to manage the strength of this chewing muscle, but also the laxity of the skin with aging. So if you bite together for me and then relax and then bite, that's a good centimeter of muscle activity. This masseter muscle is hypertrophic, and it's something that we can reduce with toxin. We're going to see the result of that within the next 4 to 6 weeks. The risk is if we reduce that strength, we're also going to potentially worsen a little bit of the soft tissue laxity further down the lower face. And so this is why we need a combination of both the volumizing filler to lift backwards and then the toxin to reduce the muscle bulk. And in combination, that will be the best way to create a more beautiful, feminine V-shaped taper to the face, whilst also keeping the tissues lifted and projected backwards. A couple of other additional bonus treatments to enhance the femininity and preserve that in the face. The first one, if you look from the side profile, I just noticed here we've got a little bit of flattening of the frontal bone at a prominent brow, and a youthful feminine forehead would be more convex. And so I'm going to use filler to create that convexity in the upper face. The second thing is the lips. Because Courtney has such a beautiful frame in the lower face, she can afford to have fuller lips. And so a lip treatment in this case would be indicated and would be very suitable. So the treatment plan today is going to be focusing predominantly on the lower third with the mandibular angle, the lateral cheek with some volume and the lips, but we're also going to treat the forehead as well. Does that sound good? Okay, let's get to it. Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma.
So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
So first of all, let's begin with toxin treatment. And I'm going to talk about how I inject the masseter muscle to avoid complications and also to get the best results. So the first thing is, if you bite together for me, I'm going to palpate for a very clear anterior border of the masseter muscle. Bite again. Wonderful. Okay, so this is the anterior border of the masseter. Okay, I'm also then going to follow the lower earlobe connecting to the corner of the mouth. Okay, so this gives me a nice corner, a nice quadrant that I'm going to be injecting in. If you relax and bite together, I find the most projected part of the masseter and relax, bite again. And then I'm also going to include, relax and bite again, a few other points, relax, bite again, where I feel we've got a lot of contraction. One more time, perfect. So this muscle now, and one more time, bite, it's also actually quite powerful up here. And in this case, I don't want to miss this area because I feel like it won't get the best result. The masseter has quite a large area of projection in this case. Relax and bite. Yeah. We're going to go a little higher otherwise. So let's talk about the risks of the masseter muscle. First of all, we're concerned about cosmetic risks in this case. With toxin, it's always about droops and asymmetry. And one of the muscles coming from the modiolus of the mouth laterally is the risorius muscle. The risorius muscle inserts into the modiolus, and we need to give ourselves a good 1 centimeter clearance from the anterior border of the masseter. So I don't inject more anterior than this line here, and this is giving me 1 centimeter clearance from the masseter. So this is how I'm going to reduce the risk of hitting the risorius. If I did hit the risorius, it would create a smile that would be quite asymmetrical. The second thing is we have the parotid glands, and obviously these injections are going deep down onto bone in the muscle. This masseter muscle lives on top of bone, and it actually has two depths. It has the deepest depth, then it has a deep tendon, and then it has the more superficial depth. And in order to get the best results for especially a masseter like this, is you want to treat both the deep and the superficial fibers. And I'll show you my injection technique to achieve that as I'm injecting. But in summary, we're staying inferior and posterior in the lower face. We're keeping away from the risorius muscle by giving ourselves a good centimeter away from the anterior border of the masseter. And we're injecting to try and target both the deep and the superficial muscle fibers. So this is 30 units of toxin. Normally I would use around 20 to 25, but in a stronger muscle like this, I'm going to increase the dose. I've identified 1, 2, 3, 4, 5, 6, 7 points, and I have 0.7 in my syringe. So each injection is 0.1 mils. And I want you to relax for me. We touch down onto bone. You have to go all the way down to there, and then I'm going to inject half of my product onto bone, and then I'm going to tail off the other half as I slowly remove the needle. And I'm going to repeat that across every point. So this one, I have to really push down like this to find the bone. I'm injecting half my volume, and then I'm tailing off as I come back. And we'll continue this approach all the way through these points where I've identified where the masseter muscle is strongest.
And what happens if you don't treat the superficial fibers adequately?
What I've seen in the past is that we end up with bunching up of the muscle. And so if part of the muscle is contracting and another part of the muscle is relaxed, we get strange contraction patterns, and they can create these cosmetic anomalies, which can often be resolved with additional toxin. Have you seen that before, Max?
Yeah, it's almost like a paradoxic bulging.
Yes.
But I've still, in patients who are bruxist, they've still had improvement of their symptoms because the muscle's still weaker. It's just cosmetically looks a bit strange.
How was that, Courtney?
Great.
Good. Great. So now we've treated with botulinum toxin. We're going to now create some initial layers of volume laterally to start to lift along the jawline. Turn this way. We won't notice the effect of this for 4 to 6 weeks, and so it's going to take some time. And when I bring Courtney back for the review, that will be the best time to see the effects of the toxin treatment. But it's not a problem now to start thinking about where I want my volume to be for contributing to this lateral projection that I want to achieve. And so if we look at the area where I want to treat, in this case, it's covered by this dotted line. And I'm really conscious that I don't want to lose this beautiful definition that we have on the cheekbone. So if required, I could put a little bit of definition along the zygomatic arch whilst I'm doing this treatment, so that I maintain this really beautiful cheekbone structure that Courtney naturally has. But the priority for me is to try and make sure I have good volume in this lateral posterior aspect of the midface. To do that, I'm going to use 1 ml of Rejuvenation contour per side to inject with a 22 gauge cannula. Little scratch coming in now. Good. So let's remind ourselves of how to inject this area. In young patients, when they haven't had any biostimulation, we can find that the cannula will find a really natural path. Okay, this is the kind of depth we want to be injecting in this area. We can tell that we haven't gone beneath the parotid masseteric fascia, so we're in the subcutaneous plane, and we're injecting in this continuous anterograde and retrograde direction. And I'm overlying this very strong chewing muscle because I'm anticipating that it will reduce in size over the next few weeks. But the majority of my volume is focused on where there are areas of concavity in this part of the midface, which is up here. This is where we have redistribution with aging. So we do have laxity of the skin, we do have redistribution of the subcutaneous fats, and so patients will end up becoming more hollow in this area with a little bit of laxity emerging along the lower face. This is the treatment that can help to reposition the tissues back to their more youthful position. To here, I'm just keeping a little bit of volume remaining to enhance the cheekbone here. And to do that, I'm just going to go over towards the zygomatic arch like this. And I'm just going to make sure we keep this lovely definition with just a few tiny deposits of filler in the subcutaneous depth whilst I'm treating this area. Perfect.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
Okay, so let's take a look at what this initial treatment has done. You can sit forward. Let's look into the camera for us. And just zoom out a little bit, please. Just looking straight ahead. Perfect. So I hope you can appreciate already that this side of the jawline is lifted compared to this side. If you look at the most pronounced part of the jawline, it's here. On this side, it's more like here. And the reason that's been possible is because even before we've reduced the size of the chewing muscle, the volume here is starting to lift and reposition the tissues. And so you can already see this more feminine shape emerging on this side. Also, just those few depositions along the zygomatic arch has pronounced the very natural shape to Courtney's cheekbones. So I've managed to enhance that and preserve that, even though I've added volume underneath. A lot of patients are concerned that if they have volume here, they will lose what they naturally have up here, but we can avoid that if we inject in the right way. Let's move on to the same on the other side.
I think for people getting started with this, even though it's, once you're in the right layer, it's relatively simple, it can feel unusual to push through those little septi
Yes.
underneath the skin.
That resistance makes people feel uncertain.
Yeah, definitely. But I mean, Courtney, you'll tell us, it's something that probably feels strange, but it's not painful as such.
Not painful.
And it probably, someone who's looking on looks more uncomfortable than it actually is. And again, because this is lateral to that line of ligaments in an area that isn't mobile at all, you can use a slightly higher G' or firmer product than you initially think, considering it's a layer 2 treatment.
Yeah. Also, I find if you find this and you're pushing and you're struggling to get through this part of the tissue, if you just force it, it can be quite uncomfortable and you can often pop into the wrong plane. And so what I do is I have these little tiny micro movements that allow me to quickly navigate through obstructions, and that is more comfortable for the patient, and it also allows me to have less trauma when I'm injecting. Mm-hmm. So little micro movements I found with cannulas are quite effective.
And you're always using your other hand to provide that counter traction against your direction of movement.
So let me just show you how, again, I want to make sure I've got some cheekbone definition. I'm comfortable injecting in the subcutaneous depth here because we're not in an active part of the midface. This is a passive part of the midface. And so as I go along the cheekbone here, I can just make sure I've kept that definition along the zygomatic arch without having to make a new entry point. I can create this shape underneath the skin.
Yeah, nice. When you say passive, you mean in terms of movement?
Exactly, yeah. Give us a really big smile, Courtney. this part of the face doesn't move on animation. And so we can inject just under the skin without worrying that the muscles are going to move this filler around when the patient smiles. Last injection now, just a little bit further up here. Okay, there you are. Thank you very much. So let's have a look at this together. Just back into the camera for us. So here I hope you can appreciate now we've treated both sides, starting to create that lift along the lower face. And we've still got very nice shape to the cheekbones. Next, we're going to move on to the lips, and this will start to see the final result when the patient comes back in a few weeks' time.